According to 2018 North Carolina statistics, 30.9% of teens between the ages of 10 and 17 were obese. Thus, nearly 1 in 3 teenagers in our state is obese. Hello, I am Jordan Blake, and I am a junior health promotion major. And this is my colleague, George Venturella, who is a senior health promotion major. The title of our project is Health Behaviors in Middle School Students, Designing a Wilson YMCA After-School Program. We would like to thank Dr. Susan Bain, Dr. David Abilene Judge, Brian Randall, Christy Levensey, and Jenna Davis for their assistance. We would also like to thank North Carolina AHEC for the opportunity to participate in the AHEC Scholars Program. As Area L AHEC Scholars, we have developed a better understanding of healthcare in North Carolina and the health disparities within it. Thank you to Area L AHEC President and CEO, Debbie Futrell, for her support throughout this project and our 2 years in the program. Here's an overview of the items we will be discussing today. We will begin with a literature review on the importance of middle school student health and the benefits of an after-school program. Then, we will address the purpose of our study, go through the methods, explain the results in which the health program planning cycle will be highlighted, and finally, finish with the future direction of the project. We will begin our literature review with statistics from the United States. First, 1 in 5 Americans experience a mental illness in their lifetime. Second, adults in the United States consume fruit only about 1.1 times per day and vegetables about 1.6 times per day, with adolescents showing even lower intake. Recent reports also project that by 2030, half of all adults in the United States will be obese. Finally, 81.6% of adults and 81.8% of adolescents do not get the recommended amount of physical activity. In this study, we are looking at the development of an after-school middle school program here in Wilson. But why the focus on middle school students? There have been several recent studies to show that middle school is a significant time in the development of children. The U.S. Census Bureau in 2014 found that adolescents and young adults make up 22% of the population in the United States. This is a large portion. It has also been found that the behavioral patterns established during this time period help determine their current health status and risk for developing chronic diseases in adulthood. Finally, middle school is a time of development when children are particularly sensitive to their social environments. Thus, an after-school program would prove to be beneficial and effective, and a critical point in establishing healthy behaviors. So now, we have established that middle school would be a prime time in a child's life to make lifestyle changes. But what information do we know that shows an after-school program would be effective? To begin, after-school programs have been found to play a role in decreasing childhood obesity, which is, of course, a desired outcome. In addition, at the conclusion of one after-school program study, the participants' lifestyle incongruence about substance abuse greatly improved, as well as their commitment to avoid risky behaviors. It can be seen that significant health behavioral improvements were made as a result of this program. Further data have shown that there is a need for after-school programs. In 2014, 41% of children not currently in an after-school program would be enrolled if one was made available to them. There is a desire by children to be involved in such an environment.
We gained interest for this topic due to our Summit Health Promotion course, HEA 445, which is titled Health Program Planning and Evaluation. This picture shows the textbook that we are using in the course. In this class, we are exploring a model titled the Health Program Planning and Evaluation Cycle. We are also taking this cycle and using the development of the YMCA program as a real-life example. In order to determine what health programming is needed, there are various steps to be taken, and we will share the steps that have been taken in developing the YMCA program thus far. Therefore, the purpose of the study is to examine the health program planning cycle involved in the development of a middle school after school YMCA program in Wilson. Our methods involve the utilization of the health planning and evaluation cycle. This cycle allows for the identification of a health problem, planning an intervention, and evaluating the process. The initial goal is to identify the health problem, and that occurs through assessing community needs and assets. Once that occurs, then the health priorities are identified, and the health program planning can begin. Included in this process is the identification of assessment instruments to be used and effect outcomes, which are the effects of the program. These steps are being utilized in the planning of the YMCA after-school program in Wilson.
Now we will examine the results of the study, demonstrating how the steps of the planning cycle have been used to develop the YMCA program. The first step was to conduct a community health needs assessment. This process allows us to identify and prioritize significant health needs in Wilson County. It was a collaboration of the Healthcare Foundation of Wilson, Wilson County Health Department, and Wilson Medical Center. This report was 150 pages long and included both primary and secondary data. The primary data consisted of a community survey distributed through online and paper submissions, 3 focus group discussions, and a community health summit. 600 Wilson County residents were surveyed in this assessment. Secondary data were collected from Conduit HCI's Community Indicator Database. The data with implications for planning the YMCA program will be highlighted at this time. Figure 18 is part of the secondary data gathered and show the child poverty level in Wilson County. This is compared with North Carolina and Health ENC counties, which are counties in eastern North Carolina. In the graph, Wilson County is represented by the blue bar. It can be seen that the rate in Wilson County is much higher than the rate for North Carolina and Health ENC counties at 39.3%. Similarly, Figure 27 shows the high school dropout rate for Wilson County compared to North Carolina and Health ENC counties. Wilson County is represented by the blue line, and the high school dropout rate has recently been trending upward compared to North Carolina and Health ENC counties, in which the trend is fairly stable. Figure 44 was a part of the community survey taken and shows a list of health behaviors that were ranked by residents as topics that Wilson County residents need more information about. Substance abuse prevention was the top health behavior residents said they needed more information about, followed by eating healthy and nutrition, going to the doctor for yearly exams, and managing weight. Here are data from the focus group discussions. In each discussion, topics were recorded for frequency. Exercise, nutrition, weight, and obesity were the most frequently discussed by residents with a frequency of 26, followed by access to health services at 21. These were followed by the topics of children's health, mental health, and alcohol and substance misuse, as well as healthcare navigation and literacy. Figure 41 shows the rankings by community residents of the top quality of life issues in Wilson County. Poverty and low income were most frequently ranked as the #1 issue at 34.5%. Substance abuse was ranked second, and dropping out of school ranked third. All of the data within this assessment help to determine what the most significant health needs in the community are.
Given the data shown, the top 3 health priorities were identified as obesity, fitness and nutrition, and mental health, including alcohol and substance misuse. It is these 3 priorities that will be the main focus for improving the health of Wilson County over the course of the next 3 years. After determining the significant health needs, the next step in the cycle is planning how to implement the programs. Based on the results of the Community Health Needs Assessment, 9 community aims were established. Each aim identifies strategies, action steps, and leadership in order to accomplish its goal. One community aim was that Wilson will be a community that embraces a culture of health. One strategy identified was to establish a comprehensive after-school middle school program for students in Wilson County. Thus, the development and implementation of a new YMCA middle school after-school program began. This was made possible through a strategic initiative from the Healthcare Foundation of Wilson, who invested $22 million to build a new YMCA that would house the after-school program. Following the results of the Wilson Community Health Needs Assessment, the next step in the health planning cycle is the health program planning. This was accomplished by developing the Wilson Wellness Collaborative Strategic Plan. The Wilson Wellness Collaborative represents a cross-sector collaboration of community stakeholders committed to the improvement of health and wellness in Wilson County. 9 sessions were held over an 8-month period to develop the plan to address the identified significant health needs of the county. There were numerous outcome targets identified in the plan. Currently, a team of individuals is determining what the specific outcomes will be for the Wilson YMCA Middle School After-School Program. Potential outcomes include decreasing the obesity rate, increasing access to exercise opportunities, decreasing incident rate of overdoses, decreasing teenage pregnancy rate, decreasing STI rate, improving academic performance, and preparing for career planning. This program is being modeled after a highly successful after-school program in Asheville, North Carolina. The name of that program is In Real Life, or IRL. IRL provides a high-quality, hands-on, equitable, and accessible after-school programming for all Asheville City School middle school students. Brian Randall was the program director for IRL and is currently serving as the interim director for the Wilson YMCA program. In his role, he is helping to design and implement the program. His next goal is to coordinate a network of community service providers to create impactful opportunities for middle school students as a program participant. For example, students will go out into the community to participate in programs. An example of a proposed program is College Life 101. Students would come to Barton College 1 day a week for 10 weeks, where middle school students will experience life as a college student. With the start date being August 2022, there is a lot to be done. Several steps outlined in this slide are beginning to happen now. The YMCA is being designed and will be built. Essential staff will be hired. Pictured here is Brian Randall, who is finishing his 1-year interim year as the program director. The specific details of the program are continuing to be developed. For example, effect outcomes, or outcomes that the program will target, need to be determined. Community service providers need to be identified, and continued input from current middle schoolers needs to occur through further focus groups. This is the blueprint of downtown Wilson, where the new YMCA is to be built. At the end of this $22 million project, downtown Wilson will continue to become revitalized and make a positive impact on both the youth and community involved. We appreciate your time, and please let us know if you have any questions or comments. References are available upon your request.